Jemperli. Indications. Jemperli, in combination with carboplatin and paclitaxel, followed by Jemperli as a single agent, is indicated for the treatment of adult patients with primary, advanced, or recurrent endometrial cancer, EC. Jemperli as a single agent is indicated for the treatment of adult patients with mismatch repair deficient, DMMR, recurrent, or advanced EC, as determined by an FDA-approved test that has progressed on or following prior treatment with a platinum-containing regimen in any setting, and are not candidates for curative surgery or radiation. Important safety information. Severe and fatal immune-mediated adverse reactions. Immune-mediated adverse reactions, which can be severe or fatal, can occur in any organ system or tissue and can occur at any time during or after treatment with a PD-1, PD-L1 blocking antibody, including Jemperli. Monitor closely for signs and symptoms of immune-mediated adverse reactions. Evaluate liver enzymes, creatinine, and thyroid function tests at baseline and periodically during treatment. For suspected immune-mediated adverse reactions, initiate appropriate workup to exclude alternative etiologies, including infection. Institute medical management promptly, including specialty consultation as appropriate.
Additional important safety information will be shared later in this video. Please see full prescribing information, including medication guide, at nearby links on this page, or visit jemperlihcp.com. I've been an oncology nurse for 12 years, specializing in gynecological cancer care. I knew going in that working with people with cancer would be tough. Each day brings its own set of challenges. Cancer's a scary diagnosis to be confronted with. Each patient I work with is different, and each treatment journey is unique, especially for my patients with endometrial cancer. Some of my patients told me they knew something was wrong, but they weren't sure how to talk about it, so it took a while to get to a diagnosis. And when they did, they felt invisible since their family and friends don't know much about endometrial cancer or how to help them. Like Cheryl. I could tell she was struggling with her diagnosis. She felt so alone, even though her friends and family wanted to help. As a nurse, I knew I could help her feel more empowered by educating her and her care partner about her endometrial cancer and her treatment plan, discussing resources she may find helpful, and encouraging her through each step of the journey. I was able to shed some light on an immunotherapy she would be taking called Jemperli. This is why I love what I do. I help patients like Cheryl and their care partners understand what to expect with Jemperli and do my best to make them and their care partners feel confident and hopeful through education and support. I've got a lot of responsibilities, and my day-to-day can be overwhelming, with not a lot of time for myself. But being able to support patients through such a difficult time and connecting with and encouraging them through their journey makes it all worth it. Each time Cheryl comes in for her treatment, I'm reminded why I do what I do. Over time, I saw her confidence grow as she started to better understand and become more familiar with her treatment plan. As a nurse, I'm proud of my work educating and supporting patients. This is our Jemperli journey.
Severe and fatal immune-mediated adverse reactions continued. Based on the severity of the adverse reaction, withhold or permanently discontinue Jemperli. In general, if Jemperli requires interruption or discontinuation, administer systemic corticosteroids, 1 to 2 milligrams per kilogram per day, prednisone or equivalent, until improvement to less than or equal to grade 1. Upon improvement to less than or equal to grade 1, initiate corticosteroid taper and continue to taper over at least 1 month. Consider administration of other systemic immunosuppressants in patients whose immune-mediated adverse reaction is not controlled with corticosteroids. Immune-mediated pneumonitis. Jemperli can cause immune-mediated pneumonitis, which can be fatal. In patients treated with other PD-1, PD-L1 blocking antibodies, the incidence of pneumonitis is higher in patients who have received prior thoracic radiation. Pneumonitis occurred in 2.3%, 14 out of 605 of patients, including grade 2, 1.3%, grade 3, 0.8%, and grade 4, 0.2% pneumonitis. Immune-mediated colitis. Colitis occurred in 1.3%, 8 out of 605 of patients, including grade 2, 0.7%, and grade 3, 0.7% adverse reactions. Cytomegalovirus infection reactivation have occurred in patients with corticosteroid refractory immune-mediated colitis. In such cases, consider repeating infectious workup to exclude alternative etiologies. Immune-mediated hepatitis. Jemperli can cause immune-mediated hepatitis, which can be fatal. Grade 3 hepatitis occurred in 0.5%, 3 out of 605 of patients. Immune-mediated endocrinopathies. Adrenal insufficiency. Adrenal insufficiency occurred in 1.2%, 7 out of 605 of patients, including grade 2, 0.5%, and grade 3, 0.7%. For grade 2 or higher adrenal insufficiency, initiate symptomatic treatment per institutional guidelines, including hormone replacement as clinically indicated. Withhold or permanently discontinue Jemperli depending on severity. Hypophysitis. Jemperli can cause immune-mediated hypophysitis. Grade 3 hypophysitis occurred in 0.4%, 1 out of 241 of patients receiving Jemperli in combination with carboplatin and paclitaxel. Grade 2 hypophysitis occurred in 0.2%, 1 out of 605 of patients receiving Jemperli as a single agent. Initiate hormone replacement as clinically indicated. Withhold or permanently discontinue Jemperli depending on severity. Thyroid disorders. Grade 2 thyroiditis occurred in 0.5%, 3 out of 605 of patients. Grade 2 hypothyroidism occurred in 12%, 30 out of 241 of patients receiving Jemperli in combination with carboplatin and paclitaxel. Grade 2 hypothyroidism occurred in 8%, 46 out of 605 of patients receiving Jemperli as a single agent. Hyperthyroidism occurred in 3.3%, 8 out of 241 of patients receiving Jemperli in combination with carboplatin and paclitaxel, including grade 2, 2.9%, and grade 3, 0.4%. Hyperthyroidism occurred in 2.3%, 14 out of 605 of patients receiving Jemperli as a single agent, including grade 2, 2.1%, and grade 3, 0.2%. Initiate thyroid hormone replacement or medical management of hyperthyroidism as clinically indicated. Withhold or permanently discontinue Jemperli depending on severity. Type 1 diabetes mellitus, which can present with diabetic ketoacidosis. Jemperli can cause type 1 diabetes mellitus, which can present with diabetic ketoacidosis. Grade 3 type 1 diabetes mellitus occurred in 0.4%, 1 out of 241 of patients receiving Jemperli in combination with carboplatin and paclitaxel. Grade 3 type 1 diabetes mellitus occurred in 0.2%, 1 of 605 of patients receiving Jemperli as a single agent. Monitor patients for hyperglycemia or other signs and symptoms of diabetes. Initiate treatment with insulin as clinically indicated. Withhold or permanently discontinue Jemperli depending on severity. Immune-mediated nephritis with renal dysfunction. Jemperli can cause immune-mediated nephritis, which can be fatal. Grade 2 nephritis, including tubulointerstitial nephritis, occurred in 0.5%, 3 out of 605 of patients. Immune-mediated dermatologic adverse reactions. Jemperli can cause immune-mediated rash or dermatitis. Bullous and exfoliative dermatitis, including Stevens-Johnson syndrome, SJS, toxic epidermal necrolysis, TEN, and drug rash with eosinophilia and systemic symptoms, DRESS, have occurred with PD-1, PD-L1 blocking antibodies. Topical emollients and/or topical corticosteroids may be adequate to treat mild to moderate non-bullous exfoliative rashes. Withhold or permanently discontinue Jemperli depending on severity. Other immune-mediated adverse reactions. The following clinically significant immune-mediated adverse reactions occurred in less than 1% of the 605 patients treated with Jemperli, or were reported with the use of other PD-1, PD-L1 blocking antibodies. Severe or fatal cases have been reported for some of these adverse reactions. Nervous system. Meningitis, encephalitis, myelitis, and demyelination, myasthenic syndrome, myasthenia gravis, Guillain-Barré syndrome, nerve paresis, autoimmune neuropathy. Cardiac vascular. Myocarditis, pericarditis, vasculitis. Ocular. Uveitis, iritis, other ocular inflammatory toxicities. Some cases can be associated with retinal detachment. Various grades of visual impairment to include blindness can occur. Gastrointestinal. Pancreatitis, including increases in serum amylase and lipase levels, gastritis, duodenitis. Musculoskeletal and connective tissue. Myositis, polymyositis, rhabdomyolysis, and associated sequelae, including renal failure, arthritis, polymyalgia rheumatica. Endocrine. Hypoparathyroidism. Other hematologic immune. Autoimmune hemolytic anemia. Aplastic anemia. Hemophagocytic lymphohistiocytosis. Systemic inflammatory response syndrome, histiocytic necrotizing lymphadenitis, Kikuchi lymphadenitis, sarcoidosis, immune thrombocytopenia, solid organ transplant rejection, other transplant, including corneal graft rejection. Infusion-related reactions. Severe or life-threatening infusion-related reactions have been reported with PD-1, PD-L1 blocking antibodies. Severe infusion-related reactions, grade 3, occurred in 0.2%, 1 out of 605 of patients receiving Jemperli. Monitor patients for signs and symptoms of infusion-related reactions. Interrupt or slow the rate of infusion or permanently discontinue Jemperli based on severity of reaction. Complications of allogeneic HSCT. Fatal and other serious complications can occur in patients who receive allogeneic hematopoietic stem cell transplantation (HSCT) before or after treatment with a PD-1/PD-L1 blocking antibody, which may occur despite intervening therapy. Monitor patients closely for transplant-related complications and intervene promptly. Embryo-fetal toxicity and lactation. Based on its mechanism of action, Jemperli can cause fetal harm. Advise pregnant women of the potential risk to a fetus. Advise females of reproductive potential to use effective contraception during treatment with Jemperli and for 4 months after their last dose. Because of the potential for serious adverse reactions from Jemperli in a breastfed child, advise women not to breastfeed during treatment with Jemperli and for 4 months after their last dose. Common adverse reactions. The most common adverse reactions, greater than or equal to 20%, including laboratory abnormalities, in patients with EC who received Jemperli in combination with carboplatin and paclitaxel were decreased hemoglobin, increased creatinine, peripheral neuropathy, decreased white blood cell count, fatigue, nausea, alopecia, decreased platelets, increased glucose, decreased lymphocytes, decreased magnesium, decreased neutrophils, increased AST, arthralgia, rash, constipation, diarrhea, increased ALT, decreased potassium, decreased albumin, decreased sodium, increased alkaline phosphatase, abdominal pain, dyspnea, decreased appetite, increased amylase, decreased phosphate, urinary tract infection, and vomiting. The most common adverse reactions, greater than or equal to 20% in patients with dMMR-EC who received Jemperli as a single agent were fatigue, asthenia, anemia, nausea, diarrhea, constipation, vomiting, and rash. The most common grade 3 or 4 laboratory abnormalities, greater than 2%, were decreased lymphocytes, decreased sodium, increased alanine aminotransferase, increased creatinine, decreased neutrophils, decreased albumin, and increased alkaline phosphatase. Please see full prescribing information, including medication guide, at nearby links on this page or visit jemperlihcp.com.